Okay. Thank you very much. I don't see the organizers, but I'm very grateful for being here and being able to talk. And I think part of our resilience is of just being together and sharing our knowledge and talking about sex. As you well know, gender relates to what we define ourselves. Sex is a biological designation. And what I'm going to talk is, of course, about autism. But first, I would like you to think for a few minutes whether the fact that we dress girls more in pink or red colors and boys in blue and cold colors, whether it's a genetic factor, whether it's a choice, or it's culturally biased, and that's how we decide for our kids. And eventually I'll get also to autism. Those are the studies that I'm going to talk about. I only have a few minutes, so it will be very briefly. But I'm very proud of many collaborations. I think the most important part of our work is to do it together and to collaborate with each other. The first few studies are from the APEX collaboration led by Professor Simon Baron-Cohen. Our other studies are in collaboration with the Tel Aviv University, and what's in black is with Haifa University with Dr. Ayelet Ben-Sasson. When we think about gender or sex-related differences, of course, we were aware of all the typical differences, and some of them are the stereotypical differences, as this picture from ChatGPT that he tried to picture the different chores that are biased. But when we look at children, we can see in typical development the different choices of toys, more mechanical toys. יש איזה head כזה? זה בסדר? כן. The more mechanical toys for boys, more caring and imaginative play for girls, and as I mentioned, the differences in the the choices of colors. So what do you think? Is it something that we do it as parents, that we give the boys to play with trucks, and we give to the girls to play and take care of the dolls, or it's something that they're born with? Much better. And why is it? Is it nurturing that makes those differences, or is it nature? Is it genetics? So I'll start with some review of different research from evolutionary research to play, social, and learning research, that all of those studies show gender or sex-related differences. From the evolution, we know that males were hunting, had to take care of bringing food, so they were more risk-taking, more impulsive, and with better visual spatial abilities, while women usually were childbearing and taking care of their children together, so they were more protective, more risk-aversive, more cautious, more selective in their partners, and they joined forces to take care of their babies and to protect their babies, so they developed better social skills. When we look at play, we can see also that girls are more nurturing when they play, more cooperative, while boys are more rough, more physical, and more athletic. Girls are better in their social and verbal communication skills, in their social bonds. And boys, when you look at, for example, their testing, they're better in problem-solving skills, in leadership, they're more competitive. When you look at math skills, actually girls and boys have about the same grades in math, but there are differences in what kind of things they're better with. When the boys are better in the math tasks, they require the visual spatial skills like geometrics. And you see here at a quote from ספר שמות, כל אישה וחוכמת לב בידיה, also refers to some gender differences from the Bible. And all those differences in the different studies brought to the theory led by Professor Baron Cohen of women being more empathizing and males being more systematizing. The question that he studied about these differences that started to be researched in adults, they brought to the question, when do those differences start? Is it something when the baby grows and we offer him different toys, or is it starting before? Is it genetically determined, or is it learned and reinforced? And what's our power to change those differences? And that's a picture of my son, who's now 33 years old. But this was, I think, one of the nicest papers that I read of Professor Baron Cohen, that he looked at babies from the days that they were born and their preferential gaze, whether it's more to the mobile or more to a person, and the differences according to baby girls versus baby boys. And eventually, what's the link that I will talk about to autism. And I'm very proud that here he was looking at me and I took a picture of his first smile. But just don't tell him, because he would ask me, why do you present my picture in an autism conference? So he did it once. When we're talking about anatomy and normal brain development, that's a recent study from our group that were looking at anatomical differences between male brain and female brain early on. We see that there are differences in the structure of the brain between females and males that are not related to the volume. Like after ignoring that male brains are a bit larger, we still see differences in different areas. And the neuroanatomists can also think about the implications in terms of behavior of those specific differences. When we also look at chemistry, we know that the sexual brain differentiation is influenced by hormones, and the brain in the fetus starts as a female brain. And the SRY chromosome that codes for specific hormones, it causes in people who have XY chromosomes. The Y chromosomes determines the female brain being changed to the male brain, and is doing that in terms of androgen receptor testosterone levels that increase, as opposite to estradiol and estrogen levels, and to oxytocin. And you all know the relationship of those hormonal differences to behavior. So it influences the male and female brain development, but also those hormones are related to our behavior. When we look, on the other hand, not on the biological differences, but on the culturally biased differences. We also see that there are many influences that we do it sometimes unknowingly. For example, we're looking at the way that we talk to girls as opposites to the way that we're talking to boys. We see that caregivers and even strangers, when you address a boy or a girl, we talk differently. Like to a girl, we usually will compliment her looks, like what a nice dress you have, or what a nice ponytail. And to a boy that we see, we usually compliment an activity, how well you run, how strong you are. To girls, we have more emotional language, and we're using more words and more adjectives. And to boys, the directed speech is usually more commands, verbs, comments, and we ask them yes, no questions. So then we shouldn't be so surprised when they're teenagers, they just know yes or no to tell us. So from those studies related to cultural and genetic and anatomical influences that differ between males and female brain, I will allude to the male brain theory that, as you remember, when it first appeared in about 2003, this theory was also led by Professor Baron Cohen. It caused a lot of debate, but when it was supported by so much scientific research, we all started to look into those differences and to think maybe the autism is an extreme of what we know about the male brain. Because we know in autism the special systematizing skills are more advanced, the visuospatial skills. There is female resilience, as I will show, as opposed to male susceptibility to autism. Hormonal influences that I'll show you one study. The empathic responses are different, and also the way that we talk to kids with autism is more, like I said, about how we talk to boys than what I said about how we address girls. We know about the difference in the prevalence, but this difference is changing. This is from the CDC. In 24 years ago, the difference was of 1 female to 4 to 5 males. The prevalence now is 1 in 3. So this male to female ratio is changing, but still today, with all the recent studies, we still find that autism is predominantly a disorder of boys, although in every daycare and kindergarten we see more girls than we saw 10 years ago, but still the predominant ratio is of males. We also know from research in autism and gender differences in autism that boys have higher severity of impairment of function. They often have co-occurring ADHD, or maybe we less recognize it in girls. Girls have better adaptive functioning, and we became familiar with the term of camouflage, of masking, by other diagnoses, especially in girls. So there is camouflage even by being a girl as opposed to a boy, but also co-occurring conditions in girls increase this delay in diagnosis, like global delay, anorexia nervosa, ADHD. If they are comorbid in girls, they cause even more delay in diagnosis. This is a study that we did from the data of Tipot Chalav in Israel, where we tried to look in the data of the early surveillance of children, if we can build a prediction model based on the early signs that they see at Tipat Halav. We crossed those very early things that are checked at Tipat Halav, and we selected 59 features related to the family, related to the birth parameters, and to the development. And we try to recognize, and this is led by Dr. Ayelet Ben-Sasson. We defined a few developmental red flags that we can know upfront, and of course we could guess, and that this is what we're going to find, that autism is more frequent in males. It correlates with advanced parental age. We didn't have paternal versus maternal from Tipat Halav, only parental age, with overweight, higher head circumference, birth type of C-section versus vaginal birth type, family history of autism, of course, as we know, and also milestones that children failed. And you can see that already at the 12 to 18 months, there are milestones that correlate highly with autism, and they're very, very easy to check early on. But since I'm talking about sex differences, we try to look whether those markers that we find, except being either a female or a male, if the signs of autism are different according to girls or versus boys. And just to make the whole story short, we didn't find any differences. Maybe because we're using the same examination tools, but that's a study that we looked at markers that came before the diagnosis, but we found that the early markers are similar between boys with autism and girls with autism. We'll try to look even earlier what's happening in the fetus. As I said, the brain differences start before birth. So we try to link what we see in the fetus to the hormonal differences, and we use the marker for hormonal difference that it's called AGD. It's anogenital distance that it can be seen by ultrasound. It's not very easy to find, and it's bit of a difficult measure, and we refer to this marker as a marker of fetal sex steroids. We followed almost 600 pregnancies with a lot of data, and what we found that we can find differences in fetuses that eventually at follow-up we found out that they have autism in terms of hormonal testing, in terms of other risk factors like gestational diabetes. And just to mention that in this study we used an outcome measure of full examination of the child, but also a screening measure called QChat. But as opposed to other countries where the QChat atypicality is beyond 40, in Israel we find the significance is beyond 35, so our parents are responding more positive. So if I'll summarize all this overview on typical and atypical differences, we can conclude that, as we all know, male and female brains are different. The sex-related differences start long before birth. But when we look at male brain and at males, we know that they are more sensitive to autism. but the autism signs and symptoms are quite similar in males and in females, at least from the perspective that we're using the same measuring tools. I always have to say we're measuring the same in males and in females, and we find that females with autism are similar to males with autism. And I'd like to finish with this quote of Temple Grandin, that the world needs different kinds of brain, so it's very nice to have it. But on a very, very different note, we cannot close the lecture without mentioning that we're all hoping for the immediate release of all the hostages, because this is Noya, a girl with autism that was interested in Harry Potter and was murdered already on October 7. And I want to thank the many groups of collaborators, and I'm sorry that I cannot go over all the names. Thank you very much.